Let's take a look at the veins of the abdomen. The first vein to identify is the common iliac vein, and the common iliac vein is, we have a right and a left common iliac vein. I'm going to show you in the textbook and then on the model. So this would be our right common iliac vein, and this our left common iliac vein. Similarly to how we had common iliac arteries, we have common iliac veins. These veins are going to be draining into or dumping blood into the inferior vena cava that's carrying it up to the heart. In the model, again, we see the inferior vena cava here and the right and left common iliac veins. The external and the internal iliac veins are going to be draining blood into the common iliac vein. The internal iliac veins are here in the model. In the textbook, we see them here. Okay? And the external iliac is going to be draining blood from the lower limbs and carrying that blood to the common iliac, which then drains it into the inferior vena cava. You don't need to know the internal iliac veins for your practical, but I wanted to point them out just to show you that you have similar iliac veins as you do iliac arteries. The renal vein is similar to the renal artery in that these veins are going to be draining blood from the kidneys. So we see the right kidney and the left kidney here. These are going to be our renal veins. In the textbook, again, we see the left kidney and we see the left renal vein draining blood from that left kidney. The next vein to identify is, I'm going to point out what is known as the ligamentum teres. So the ligamentum teres is associated with the liver. It is a fibrotic structure that was once a vessel when you were in utero during your gestational period. And if we take a look here, is an illustration of the liver, and we can see this fibrotic structure right here is what's known as the ligamentum teres, and we see the ligamentum teres here as well. Unfortunately, it is not shown in the model that I'm using. The next structure to identify is the hepatic portal vein. The hepatic portal vein is an extremely large vein that receives blood from many of the digestive organs. We take a look at the illustration here in the textbook. This is our hepatic portal vein. It is going to be receiving blood from much of the alimentary canal or the digestive tract, so small intestine, large intestine. All of this blood is going to be draining into the hepatic portal vein, as well as blood being drained from, this is the pancreas, the spleen, the stomach. All blood that's drained from these digestive organs are going to be, that blood is going to be dumped into the hepatic portal vein. It's going to circulate through the kidney, through the liver rather, detoxify, and then be dumped into the inferior vena cava. Difficult to identify the hepatic portal vein in this model here. The splenic vein, let's identify it in the picture. So again, here's the spleen. Here's the spleen in the model. The splenic vein we can see is this kind of tortuous or convoluted vein that is going to be dumping blood into eventually the hepatic portal vein. And we see that here is our splenic vein in the model. The intestinal vein, going to point out some intestinal veins for you. So here in this illustration, we can see many of these veins that are arising off of the intestine. So the small intestine here, these would be our intestinal veins. Intestinal arteries I didn't cover. I think I forgot to mention those when we went through the arterial structures, but intestinal arteries are going to be in a similar fashion as intestinal veins in that they are arteries that are carrying blood to our intestine.